Healthy San Francisco program is fair? Please explain.
Well, I think the reality is that we all, in different levels of government, have to tackle this really difficult issue of healthcare for every individual. You know, when I was on the Board of Education, the Board of Education budget was about 500 million. The health department's budget now is over $1 billion. And so we have increased our healthcare budget to double what we spend in public education right now. And part of the increase is the fact that more and more individuals who don't have health care are accessing our emergency services and really sapping a lot of dollars that we could better use for other healthcare needs. And so that's a reality. So the question is, what is the solution? Healthy San Francisco is part of that. What we've got to do, from my perspective, is that we've got to look at expanding that. We've got to then bring other individuals into that particular mix so we can spread that particular cost and bring other individuals who are a lot healthier into that, and that's how we're going to expand Healthy San Francisco and then make it a lot more viable. In addition, we've got to look at other partners in this particular area so that their services are going to be provided. That you're not going to then end up having individuals constantly in waiting lines, in clinics, in primary care facilities. You've got to somehow expand the reach of individuals providing those services.
Thanks. Bevan.
Yeah, I think Healthy San Francisco is a great program, and it's something that I'm extremely proud of having voted for, been the 8th vote for it, which really made it clear that it was going to happen after the city's Blue Ribbon Task Force. As I said earlier, with the advent of federal healthcare legislation, we have about 52,000 people that have signed up. Yes, it's tough to initially get your first appointment, but it's kind of like once you're in, and people that have given me feedback, my barber, self-employed, hadn't had health insurance for years, and I think it's a great thing. I mean, the thing that's scary is that most of the people that are running against President Obama don't feel like they're in a different country. They feel to me like they're in a different solar system. So I'm hopeful that, you know, we're not going to see a repeal or not see a change. But again, a lot of the participants in the program are going to be immigrants, and we're going to have to make a case to the city that having healthy immigrants in San Francisco who are not afraid to get tested for TB, not afraid to get the preventative care that they need, improves the health of our entire city. And I think that's a case that we can make effectively. Thank you.
I'm sorry, there's a question around Healthy San Francisco, the healthcare security ordinance.
It's the healthcare security ordinance, but I think it's referred to as on the books healthy care security ordinance, i.e. Healthy San Francisco.
They're actually two slightly different things, but first of all, I agree with my colleagues that Healthy San Francisco is a model program of universal health care in San Francisco, one that I absolutely supported. We need to make sure it continues to be a model as we move forward. The healthcare security ordinance is a very contentious issue right now in City Hall. Let me explain. The supervisor of the mission, Supervisor Campos, recently exposed the fact that right now under the healthcare security ordinance, there are some businesses that are not paying what other businesses are paying to make sure that their employees are receiving the healthcare benefits that they should receive. Now, in order to close that loophole, though, it could mean that there will be businesses that will have to pay millions of dollars more. And that is very difficult at this particular economic climate. And so, to directly answer the question, I think we need to find that appropriate balance to make sure that we are taking care of all of our workers, all of our employees, but do it in a way that is not going to unduly burden companies, particularly small businesses, as we're coming out of the Great Recession.
Thank you. And Dennis?
Healthy San Francisco has been a model program, and there are many people up here who have played an important role in its development. And I'm proud of the role that the City Attorney's Office played with Supervisor Ramiano and Mayor Newsom in drafting it in a defensible way and then pursuing the legal strategy to assure its protection as it worked its way up through the courts. Ultimately, we defended it all the way to the United States Supreme Court. We all know that it is cost effective, and we are providing now healthcare access for 50,000 San Franciscans that didn't have it before, and we're doing it in a cost effective way by limiting their ability or requirement that they go to the healthcare provider of last resort when they had medical problems, San Francisco General Hospital. So that wasn't just good from an equitable standpoint, it was also saving the taxpayers money who were funding those costs in San Francisco in general. But David is absolutely right in saying, with respect to the healthcare security ordinance, we have to make sure that we are striking the right balance so that in a difficult economic time we are not imposing additional burdens on small business to a point where they are suffering a competitive disadvantage as a result of what it is that we're doing. So I think it needs real appropriate discussion, a good look-see, and we have to make sure we strike the right balance to make sure that healthy San Francisco is protected to its full extent.
Thanks. And John.
Thank you for the question. The healthcare security ordinance. I think it's. I want to thank small businesses, restaurants, merchants who are paying into the healthcare security fund to be able to show that workers, people in San Francisco can have access to healthcare, and that Healthy San Francisco can be a vibrant program. I think it's unfair that we have to do it at the local level, that we don't have single-payer healthcare in this country, and that we're forced to do our healthcare at the local level. We are the one industrialized nation, one of the wealthiest nations in the world, probably the second wealthiest, and we don't have universal health care for our citizenry and residents. That is just ridiculous. And we have to be able to create the conditions to move the policy debate from the local level to the state and the federal level to ensure that we can have access to health care. So we don't have to have programs that are more challenging at the local level. We need to have more robust funds at the state and federal level to make our healthcare system really work. Single payer is the way to go.
Great. Thanks everyone.